Good morning. You all hear me okay? Great. Well, welcome. We're pleased to be re-inaugurating the Natcher Auditorium here on the NIH campus in a setting which has, I think for many years, impressed me by their attention to total worker health. So it seems very fitting that we would be here today. It's been 4 years. I'm Lee Newman. I am a professor at the University of Colorado at the Colorado School of Public Health, where I direct one of the 10 centers of excellence in total worker health. And I want to welcome you all here today, those of you who are in person, as well as those of you who are joining us virtually. I'd like to start, though, by sharing with you a land acknowledgement. As organizers of the symposium, we wish to acknowledge that this conference is being held on the traditional and ancestral homelands of the Anacostan and Piscataway peoples, who have served as stewards of the region for generations. Washington, D.C. and Bethesda have been the home to dozens of tribal nations that thrive along the Anacostia and Potomac River watersheds, the Chesapeake Bay area, and the states of Maryland, Virginia, and Delaware. Here we sit on the ancestral lands of the Anacostans, also documented as the Nacotchtank, and the neighboring Piscataway and Pambuki peoples. We gratefully acknowledge the native peoples on whose ancestral homelands we gather, as well as the diverse and vibrant native communities who make their home here today. We're grateful for their past and continued stewardship of this land. So we gratefully acknowledge this as an opening for this conference on total worker health. As I said, it's been 4 years. And in that time, we've seen some remarkable transitions in spite of, and in some ways, frankly, because of the COVID pandemic. Total worker health has, I think, made an important transition. We've transitioned from defining it by saying what it's not to being able to define what it is. And I think that the pandemic has, among the things that we have learned thus far, is that the health and well-being and safety of workers is critically important. And I think that for us, it has caused us to want to double down on our efforts to help people understand in industry and labor, through our research, through our educational programs, to understand that we really can have an impact on society where more than half of our country are in the labor force. Internationally as well, I think that we've learned many lessons about how critically important it is to have all of our workers healthy and safe on the job. So I'm glad that you're all here. I'm glad that you're going to be able to reconnect and connect anew with each other. We're excited to have such a diverse and interesting group because we're in a transdisciplinary field, a field in which what we really need to be able to do is to have people who bring different skills and knowledge to work together on one of society's big, wicked problems, which is the health, safety, and well-being of workers, nationally and internationally. With that, what I'd like to do is to have you help me welcome Dr. Casey Chosewood, who is the director of the Office of Total Worker Health at CDC NIOSH. So please help me welcome Casey Chosewood.
Good morning. It is an awesome privilege to be able to stand before the aspect of worker well-being forward, whether it be physical, mental, psychosocial, family-related, productivity-related, work-related, home-related. Whether it means that the total is every single specialty and occupation and discipline represented in this audience today. You are the T in TWH. The work that we have is totally and vitally important to the success of occupational safety and health. One of my mentors is Dr. Steve Sauter, and he likened the development of the total worker health movement, really to the very most important next iteration of the way we work. And I think increasingly employers are seeing the vital importance of this special approach. They're not going to be able to survive by focusing on work-only issues. Every single worker brings with them challenges, risks, ups and downs every day, struggles. Every worker carries home with them exposures from the workplace, both good and bad. If we get it right, if we're able to operationalize total worker health, people can go home after work with more health than when they arrived. And that gives the opportunity for this continuous cycle of I'm healthier today than I was yesterday. And I come back to the office tomorrow with more health. And that health translates into fewer injuries, more opportunities for me to promote and grow and be happier in my work, more productivity at work, better customer service, longevity at work if I choose to work for more years, the ability to enjoy life for a longer period of time. You are the answer to making all those things happen. You're one of about 520 people who are represented at the meeting this year. It's great to see so many of you back in person, and we're thankful to NIH for allowing us to be here and to really welcome back the first big meetings post-pandemic. So it's really great. You're going to be very busy this week. This morning, we'll hear from the heads of CDC, NIOSH, and OSHA. On Friday, we'll hear a fireside chat from the U.S. Surgeon General. We're going to be talking about really critical issues, including a very soon release of a new workplace directive, a standard around workplace mental health. And then we'll also be hearing from a very inspirational photographer, Earl Dotter, perhaps the most prominent occupational photographer in the world. Our global speaker is Karina Nilsson, who will also bring a very inspiring, important message to the group. So it's a packed agenda. It's going to be wonderful. With that, I will say welcome to the Third International Symposium, and please give yourselves a hand. Okay, lead off this morning, we're going to hear from Dr. Rochelle Walensky. She's the director, obviously, of the Centers for Disease Control and Prevention. She's an influential scholar whose pioneering research has helped advance national and global responses to some pretty big emergencies. To put it mildly, she came really right before the pandemic took off and was in for a wild ride. Those things are from her formal bio, if you will. But on a personal note, I would say that Dr. Walensky is extremely warm. She's extremely employee-centric. She's extremely focused on the well-being of our own CDC workforce. And to be honest, that's been a fairly tall order over the last couple of years. So with that, let's welcome Dr. Rochelle Walensky with some remarks.
Thank you, Dr. Chosewood, and thank you to all at NIOSH, our dedicated partners, and those attending this symposium for your many years of leadership to improve the health of workers. So much has changed since the last symposium to advance total worker health. Living through a global pandemic compelled us to redouble our efforts to make workplaces safer and improve the health and well-being of the global workforce. Please know I am grateful, and CDC is grateful for the sacrifices you made during the last few years and for your ongoing commitment to help diverse communities not just survive, but truly thrive in the workplace. Perhaps no community shouldered a heavier burden during this COVID-19 crisis than our essential workers, those serving in healthcare, public safety, transportation and delivery services, retail establishments, grocery stores, agriculture, and other essential industries. They remained on the job despite the many potential risks to their own health and to their families, giving selflessly, working tirelessly, and achieving many successes, often unseen and often unrecognized by the public. Working men and women are the heart and soul of our nation. Without dedicated workers, able and productive, our society cannot function. This makes your efforts and your resolve to safeguard these workers even more vital. We need your leadership as occupational safety and health professionals now more than ever. In the United States, for example, healthcare and social assistance workers combined experienced a staggering 249% increase in injury and illness rates in calendar year 2020 compared with the previous year, more than any other industry, as they labored countless hours battling the pandemic. They faced stresses from intense emotional and physical labor to PPE shortages, fatigue, grief, and loss, and even threats of hostility and violence. These challenging work conditions, combined with increasing staff shortages, have taken their toll, leading to mental health challenges from anxiety and depression to PTSD. Public health workers have been hit especially hard. An April 2021 CDC survey of 26,000 public health workers found that 53% reported evidence of at least one mental health condition, including depression, anxiety, post-traumatic stress syndrome, and suicidal ideation within the 2 weeks prior to being surveyed. Yet there have been hopeful findings as well. A CDC workforce study from March of this year found public health workers were less likely to report mental health symptoms if they could take time off. Or, and this is interesting, they were less likely to report mental health symptoms if they believed their employer had increased the availability of mental health resources. Employees in these settings felt more cared for and supported. Building on its 30 years of research in the prevention of and interventions for work-associated stress, NIOSH launched a $20 million health worker mental health initiative focusing on improving the mental health and well-being of our nation's healthcare workers. By improving data, surveillance, and screenings, and developing a repository of best practices, resources, and interventions, the initiative is adapting response tools and developing trainings to motivate game-changing policies. NIOSH and our National Center for Injury Prevention and Control are working together to coordinate this critical campaign and assess progress over time. And we will look to all of you to help us amplify these critical life-saving prevention messages. One of our first efforts was last November's National Call to Action webinar, organized to raise awareness of how adverse mental health outcomes have been exacerbated during the pandemic. Coming soon is the launch of a new national social marketing campaign focused on lowering stigma and barriers for care seeking and normalizing the conversation around mental health. You can help us promote a positive message that workplaces can improve their culture, safeguard their workers, and foster better mental health so all can lead more fulfilling lives and remain in the professions they love. Healthier workers in our nation's healthcare settings mean healthier patients and communities. By creating sustainable infrastructure for future generations of healthcare professionals, we can truly change the culture of health organizations and better optimize the working conditions their workers face each day. While these current initiatives are focused on health workers, the lessons learned and the actions can be applied to all worker communities. We have similar work to do at CDC. During COVID-19, more than 20% of CDC's 12,000 employees were serving on the pandemic response at any given time. We learned that we do not have a deployable public health workforce necessary for the size and scale of a public health threat like COVID-19. Staff mental health concerns, including stress and burnout, are also high. So we're working to shore up and develop our workforce to be better prepared for future emergencies. And we're improving our strategies to best support the extraordinary people at CDC who are working around the clock. Truly, some of them are up all night to protect public health. As workers continue to return to the physical workplaces, we must continue to promote flu vaccines and certainly COVID vaccination. We now have COVID vaccines using several types of vaccine technology for everyone 6 months and older, as well as the just released updated COVID vaccines, which offer protection against Omicron. We must stay focused on repeating the message for all employees that this pandemic is not over. COVID is still with us, and sadly, there are many Americans who remain under-vaccinated. Staying up to date with COVID vaccines is critically important, and we continue to encourage the use of and support access to the many life-saving tools available to protect worker safety and health. And now we're responding to the monkeypox outbreak. Rapidly scaling up information on the prevention and treatment of an infectious disease almost no one in this country has ever seen clinically has been no easy task. And we are relying on your partnership to help with employee education. For safer workplaces for healthcare workers, infection control practices such as hand hygiene and use of personal protective equipment are key to preventing spread. For workers with possible close physical contact with other people or contaminated materials, employers should offer information on monkeypox transmission and prevention, and they should make sure infected workers follow isolation and prevention practices. Finally, employers should offer telework when possible and flexible, non-punitive sick leave for all. Employers in non-healthcare settings should also take steps to prevent monkeypox spread and can apply guidance for congregate settings to workplaces. Hotel operators can also apply recommendations for congregate settings in hotels. Currently, widespread transmission in congregate care settings has not been identified, but CDC and our partners remain on alert for possible spread in these facilities. Going forward, we're committed to making our guidance for workers and employees and for all workplaces clearer and more actionable. Your organization's success and the health of our nation are closely linked, and we value this partnership. As leaders in occupational health, you're a critical part of our public health system. We rely on each of you, and we pledge to be here for you. I open with gratitude and I will close on the same note. Please know that I am grateful and CDC is grateful to each of you across science, industry, government, academic institutions, nonprofit organizations, labor, and human resources for your commitment to worker safety and health. Thank you for your leadership and for staying the course during all the upheavals the pandemic caused in our diverse workplaces and communities. I hope this symposium will be a meaningful chance to connect, to learn from each other, and to approach your work with renewed energy. CDC and NIOSH look forward to our continued partnership. And now I would like to turn the podium back over to Dr. Chosewood.
Great. We're really fortunate to be able to receive those remarks, and happy to share them with you today. Next, we're going to hear from our NIH host and sponsor, Colleen Mcgowan. Colleen is the National Institutes of Health's Director of the Office of Research Services, or ORS, overseeing campus operational support activities for over 42,000 NIH staff. She leads the 2,000-person ORS, responsible for security, emergency response, including police and fire, scientific support activities like occupational health and safety, the veterinary care here at NIH, and library services, as well as campus amenities and transportation. A pivotal leader in the NIH COVID-19 response effort, she drove important safety standards for the Institute and HHS-level vaccine procurement and administration to mitigate workplace transmission of the virus while preserving all the mission-critical capabilities that NIH is well known for. Please join me in welcoming Colleen Mcgowan.
Well, hello, everyone. It's good to see you. Thank you for that wonderful introduction. Oftentimes people call me the director of problems, given all the things that I oversee. So thank you for that wonderful introduction. On behalf of the entire NIH community, we're delighted to have you join us here today for the 3rd International Symposium for Advancing Total Worker Health. This year's theme is Shaping Work Now and in the Future. It feels so good to have people together again. We've heard so much discussion about connection today from Lee and Casey, and then Dr. Walensky as well. And it's just been such a long absence. I can't tell you, on Friday, that's when the CDC changes their community levels. I'm like, please low for next week, please low, so we can continue to have this conference. The last time I was actually at a big event like this at this podium was during December of 2020, when we had our first COVID-19 mass vaccination event with the Secretary of Health and Human Services. Of course, I had my mask on at that time and was appropriately socially distanced. But that event was really the first time that I felt hopeful. I felt hopeful that we were embarking on a new journey of wellness and that people could stop being afraid to be together once again. And I was encouraged at that time that we were really going to beat COVID-19 and go back to normal. My daughter said, "Mommy, you got your ouchie with Dr. Fauci." So if that got people to be vaccinated, that's great. The pandemic was tough on so many different levels, both personally and at work, but we've come a long way since then, thanks to many of the people that are here today. In many ways, the pandemic acted as an accelerant of change, forcing supervisors to think about work in a new way. Something our chief people officer at the NIH, her name is Julie Burko, calls the next normal. We're talking openly about mental health struggles and burnout, providing resources to help staff at all levels of the organization. We're talking candidly about diversity, equity, inclusion, and accessibility, and we're listening to one another. At the NIH, we have instituted more permanent, flexible ways of working, leading to a happier and healthier workplace for all. Today, I'm delighted to work with our NIOSH partners from CDC to focus on health and well-being of those who make our work so meaningful, our staff. The NIH is honored once again to bring so many esteemed professionals from academia, from government, as well as the public together. The NIH has enjoyed a productive history with NIOSH total worker health programs since hosting the first 2 international symposiums in 2014 and 2018. We once again have a talented team who developed the content logistics of the symposium. We have had the University of Colorado at Denver School of Public Health, as well as our own NIH events management team come together to ensure that this is a successful event. It's a lot of behind the scenes work that makes this happen, particularly in a hybrid environment. So thanks to all of you. This event and the topics you're going to be discussing will be critical to all of us as we emerge from this pandemic stronger, more resilient, and laser focused on our missions. We look forward to learning more from one another at this symposium and have fun connecting with one another. Enjoy yourselves. Thanks.
Thanks so much, Colleen. Also, a big thank you to Chris Gaines, who has served really as the mayor of NIH and really in many ways has solved so many problems for the symposia over the year. In my 15 plus years of knowing you, Chris, just been a true champ, and we can't say thank you enough for all that you've done for us. So absolutely. Chris is amazing. I'm especially happy to announce our next speaker. This person has been a true friend, a mentor, has really made my time at NIOSH just extremely amazing, fulfilling, engaging. And that's my boss, Dr. John Howard. He serves as the director of the National Institute for Occupational Safety and Health and is also the administrator of the World Trade Center Health Program. He's located here in Washington, D.C. He served first as the director of NIOSH from 2002 to 2008, and then again from 2009 to 2015. He was just reappointed for a 6th term in 2015, and then again in 2021. Prior to his appointment as director of NIOSH, Dr. Howard served as the chief of the Division of Occupational Health and Safety in the California Department of Industrial Relations, Labor and Workforce Development Agency from 1991 to 2002. Please welcome my dear friend, Dr. John Howard.
Thank you and welcome everybody. I want to thank the Director of Problems at NIH. I love that title. I think I'm going to take it. And the center at Colorado, Dr. Newman and all the wonderful folks at the center for helping us put on this really remarkable, what I call Corona normal era that we're in now. As Dr. Walensky said, it's not over, but we're starting to make progress in achieving what we've always thought what happened, which is sort of an endemic era as opposed to a pandemic era. I just want to take a few minutes to say it's just wonderful to see you all, and it's wonderful to see you all virtually. And thank you. Thank you very, very much for all the work that you do in this area of total worker health. If I could be allowed just a personal observation, it was 2004. I had come to NIOSH just a short while before, and the Department of Health and Human Services at that time launched an initiative called Steps to a Healthier US, which some of you may remember. And I was sitting at NIOSH thinking, we need to figure out a way to join that initiative and make it ours. And so I added the word workforce after Steps to a Healthier US workforce, because there are special issues for workers. And the idea at the time, and still is, which then over the 18 years has become the Total Worker Health Program, is the idea that work-related issues, physical hazards and chemical hazards and biological hazards and other issues, it's more than we need. We need more than just the work relationship. We need the worker, as Casey said, bringing psychosocial issues from the home, from the community, from the environment, a larger, more holistic view of worker health, safety, and well-being. And hence, over the 18 years, it's changed to the Total Worker Health Program. So it's in my history of crazy ideas, it's just really thrilling for me to see you all here to support that idea that started in 2004. Ralph Waldo Emerson said, no army can stop an idea whose time has come. And I think that as Colleen mentioned, as Dr. Walensky mentioned, as Lee mentioned, as Casey mentioned, as all of you are witness to, we're in a different era now. We're talking about mental health. How many times have we tried to talk about that within the workplace? And people have looked at us like, no, we don't talk about that. Psychosocial issues, which NIOSH has had, as Casey mentioned, Dr. Steve Sauter, one of our pioneers in that area, for decades. But nobody else. It became, I think, for us, a congratulatory effort. Total Worker Health. Now we can talk about every aspect of worker health, safety, and well-being. Nothing is off limits. And as we're seeing now, as Colleen referred to in our hybridized work arrangements, we're starting to see attention focused on some of those issues that we're verboten to talk about, the psychosocial dimensions of work. All of those researchers who worked for decades by themselves are starting to see that their work has much, much value here and now. As Dr. Walensky mentioned, we're very privileged at NIOSH to receive funding from the Congress on mental health. I would have never thought we would have gotten that kind of funding, but here we are. And positive things can happen from this pandemic. We can learn from it, we can become better, and we can expand the scope of worker health, safety, and well-being. So thank you very, very much for all the work that you all do in this area. Thank you very much for joining us for this conference. God bless you.
Thanks very much, Dr. Howard. For the newbies in the room, on Friday, we will make some awards called the Total Worker Health Founders Award. There will be at least 4 recipients this year. So a plug to come to our award ceremony. But for those who don't know, Dr. John Howard coined the phrase total worker health. And now it is one of only a handful of registered trademarks of the U.S. Department of Health and Human Services. So it is very apt for him to have our opening remarks today. Next, we're in for a real treat. We're going to have our keynote speaker for this morning join us now. It is Douglas Parker, the Assistant Secretary of Labor. He was sworn in as the Assistant Secretary of Labor for the Occupational Safety and Health Administration on November 3rd, 2021. He served previously in the Obama administration as Deputy Assistant Secretary for Policy in the Department of Labor's Mine Safety and Health Administration. And he was a member of the Biden-Harris transition team focused squarely on worker safety and health issues. He's also held positions as a senior policy advisor and special assistant to the Department of Labor. He most recently served as chief of California's Division of Occupational Safety and Health, or Cal-OSHA, a position he held since 2019. Ladies and gentlemen, please welcome our keynote speaker, the head of OSHA, Douglas L. Parker.
Okay, I'm going to start by giving hydration a plug as part of for an element of total worker health. Good morning. I want to thank CDC, NIOSH, and the Total Worker Health Program for inviting me here today to be giving the keynote address for the morning. I want to just to also appreciate more broadly and acknowledge the strength and productivity of our partnership between NIOSH and OSHA and the important work that we've done over the years. And it's a relationship and a friendship that with Dr. Howard I appreciate. I also want to thank our host here, NIH, for putting together this fabulous facility for us to have this event in. So we are here to talk about total worker health, to share experiences and ideas and thoughts on how to integrate that to improve workers' lives. Now at OSHA, one of the key elements of our strategic planning and strategic elements of our agency's management plan is to ensure that our efforts are worker-focused and centered on workers' needs, and that we understand workers' needs by listening to them, listening to workers' voices. And so 2 weeks ago, OSHA hosted our first ever Workers' Voice Summit at the Department of Labor. And at that summit, we had more than 100 frontline rank and file workers there. They were accompanied by worker centers, labor unions who also participated. And we were gathered there to hear not only from worker centers and worker organizations about kind of ideas that they had to advance worker health and safety, but really also to hear from these workers and hear their stories. These workers had traveled from across the country to share often difficult stories to hear that were painful, both physically and emotionally. And also hear about their determination and their hopes and their ideas about how we can build bridges together to improve workplace conditions for everyone. OSHA also had our leadership from across the country there, from every region, as well as our directorates, our labor liaisons, some of our whistleblower investigators and others, to really be a part of this, to see the real life implications, day-to-day lives of these workers, and to consider how we can strengthen dialogue with these organizations, some of whom have frankly historically mistrusted OSHA, and to also consider how we can be more responsive to their needs going forward. And I wanted to share a couple of these worker stories that were shared with us. One worker leader from Mississippi talked about how her grandson was working for an employer and received no training, no task training on work at a conveyor system. And he got his arm caught in the system and it was crushed. He broke every bone in his arm and almost lost it. And importantly, the other thing that we heard from a leader from the same organization was how the Black community in Mississippi is so impacted by job steering. And she included even examples at major companies. And by job steering, I'm talking about a practice by which job applicants who are Black, who are steered into the dirtiest, most dangerous, hazardous jobs within an organization. And the important point was how that wasn't framed as an economic issue, although it certainly was, or a race discrimination issue, which it obviously was, but that the workers were framing this as a health issue. We heard from nurses who were experiencing far too many injuries from workplace violence. In the case of some nurses at a psychiatric hospital, they talked about the lack of controls to protect them from workplace violence, lack of engineering controls like inadequate lighting, inconsistent administrative controls, such as policies that would have ensured that workers weren't alone or had access to functional alarms and quick response when they were threatened. But we also heard about the challenges around staffing levels and how that impacted not only their safety, but also their psychological well-being and their ability to provide quality care to patients, which also exacerbated their psychological well-being because of the importance to them for doing a good job and caring for their patients. And again, all of this was framed as an occupational health issue. We heard from domestic workers who suffered injuries and illnesses from using chemicals provided to them without any information regarding their regarding chemical safety. And also that at the same time, they were suffering sexual harassment, sexual coercion, sexual assault from homeowners and employers while they were just trying to do their jobs. And again, this was all framed as a set of worker health issues. There were many undocumented workers talking about immigration issues. We heard about one worker, he wasn't there, but I've met him previously. He was a restaurant worker in the Philadelphia area, worked 7 days a week. He wasn't given time off to seek medical care after dropping a pot of boiling water on his foot. His employer, who had been exploiting him because of his immigration status, told him that he had to stay at work. He had to continue to work 7 days a week. This worker worked through the pain. The pain became greater and greater. He had an infection that ultimately became gangrene, and his leg was amputated below the knee because he was unable to obtain basic medical care when he needed it without risk of losing his job. And again, both the injury and the lack of paid leave and the fear-based concerns about immigration status were all framed as health issues by these workers. This is just a few examples of the hundreds of stories that we spent hours listening to. Some covered so-called traditional health and safety issues faced at work. Others, again, were the kinds of things that were about other types of health and well-being: work hours, wages, access to paid leave, childcare, interactions with coworkers, customers, and patients, concerns about reporting hazards because of immigration status or losing their job for some other reason. What I found so striking about these stories, besides the obvious sadness and empathy one feels for these workers, was just how deeply intuitive the workers' understanding was of the connection between the various social factors impacting their lives: race, gender, immigration status, poverty, employers' business decisions, and working conditions, and the physical hazards that they faced at work, that connection. Now, I've been having similar conversations with workers for years in my capacity as a public servant doing health and safety, as an attorney in legal aid, as an attorney for labor unions. And I have to make a confession that there have been times in the past where my reaction has been, well, that problem is my jurisdiction. I can't do anything about that. Let's just move on. Let's focus on the thing that I can help you with immediately, the legal problem or the thing that we can enforce. And while that's certainly true in some cases, it doesn't mean that we should do what I found myself doing sometimes, which is to close our minds to these issues as occupational health and safety professionals. And my overall point about these stories is this. If you want to better understand total worker health, spend more time listening to workers because they understand it. It's what they've been talking about for years, what we call total worker health. And that's exactly what OSHA has been trying to do. Listen to workers to get a better, richer understanding of this issue so that we can do more to help them and to actually partner with them in solutions in moving forward to improve their lives. The Biden-Harris administration and the administration of the Department of Labor, led by Secretary Marty Walsh and Deputy Secretary Julie Su, have expressed clearly to us and to the public our commitment to equity and embedding equity in everything that we do. And at OSHA, our job is to work to make sure that OSHA protections apply to all workers and that all workers are fully enjoying the rights and benefits and responsibilities that the OSHA Act is intended to provide them. We're working to ensure that vulnerable workers work in environments that are safe and healthy, and also that they feel safe in their work environment. And we're doing more than listening. We're taking action to mitigate some of these factors that make working conditions more hazardous for some workers than others. The vulnerability experienced by undocumented workers is, of course, a huge challenge. But we are building relationships with worker organizations, and in some cases, rebuilding them to gain trust. We've revitalized our labor liaison program, where we have liaisons across the country in every region whose focus is to build these bridges, to act as almost an ombudsman sometimes when there are issues with other parts of our agency, and just to make sure that we have ongoing relationships, that we're educating, and that we're learning from these worker groups. One of the things that we've also done, and we haven't launched it yet, but we have announced it. We've printed a little wallet card that every inspector can carry, and so far we've put them in. Or we've translated them into Spanish, Portuguese, Korean, and simplified Chinese. And we've done this before. We've handed out wallet cards to know your rights. But what we've done this time is to put it on the workers' language on one side and English on the other side, so an English-speaking employer can also understand it. And the first thing the card says is that you have rights, and we will respond to your issues regardless of your immigration status, so that vulnerable workers know. And so we're literally laying a marker down about how we're going to approach our work. We're also being more proactive in recommending deferred action for undocumented workers when immigration status could impact an investigation that we're conducting. We've dramatically increased funding for translation services to access many languages and ensure that workers can learn about their rights in their own language and also access important materials on safety and health. And we're strengthening our whistleblower program so workers can be participants in their own health and safety on the job without fear of retaliation. We've hired more than 60 whistleblower investigators this year, and we'll continue to hire more. In terms of particular issues, one of the other things that we heard about at the Worker Voice Summit, and should be no surprise to you, are some of the horrible working conditions and hazards workers face with respect to heat on a daily basis. As we look to proactive solutions to address worker safety and total worker health, we must look at how we can prevent and control hazards and exposures like heat. While heat is not a new hazard, acknowledging the dangers and addressing them in light of rising average temperatures is critically important. And it's also critically important to acknowledge that workers of color are disproportionately affected by heat. They are the ones who make up the workforce in industries and workplaces most affected by heat, at least, disproportionately make up, yeah. And they're disproportionately affected by the hazards of heat. So this makes heat not only a worker health issue, but also an equity issue. And I saw on the agenda that there are a number of sessions on heat, and I appreciate the focus of the symposium on that hazard. I think you've probably heard some of the statistics around that. While the Bureau of Labor Support reports that there have been about 38 fatalities on average a year from 2011 to 2019 that are directly heat related. We know that that's an undercount for various reasons. That either these deaths are not reported, or that heat's been a contributing factor in a death that's been categorized another way and not really identified as an occupational health fatality. And we also know that there have been an average of about 2,700 heat illnesses reported that have led to time away from work, and that also, for the same reasons, is an undercount. We, as you know, probably know, are working on a heat illness prevention standard for indoor and outdoor workers that will regulate heat in the workplace. But that is a multi-year process, and we are not waiting to act. We're not waiting on a standard to act. In April, we launched a national emphasis program on outdoor and indoor heat-related hazards that allows us for the first time to proactively conduct inspections in more than 70 industries where, after our review of data regarding heat-related illnesses, we identified these industries as having elevated risk. We had targeted about 400 inspections a year, but because of the enthusiasm of our staff in addressing this issue, and also, quite frankly, the high number of high heat days that we had this year that triggered our responsibility under our policy to conduct heat-related inspections. Instead of 400, we did more than 1,500 this year so far. One of the important elements of that is not just conducting enforcement, but doing a considerable amount of education and outreach, including when there are lower temperatures and we're not already at a crisis. So both employers and workers are better educated about the hazards of heat and how basic mitigation factors like rest, water, shade, acclimation can have a tremendous impact on health outcomes. Another area of important activity that I want to mention, and it's certainly near and dear to the Secretary's heart because of his own interest in worker mental health, is the work that we've been doing on suicide prevention. Again, this has not always been an area that's viewed as an occupational health issue. It's not a traditional occupational safety and health issue, but there are very real work-related implications. In 2020, more than 12 million people seriously thought about suicide, more than 3 million made a plan for suicide, and more than 1 million attempted suicide, and more than 45,000 people died of suicide. We've looked at we've looked at the research regarding a number of different sectors, and one of the things that really stands out is the is the risk of suicide in the construction industry. In construction, the rate of suicide among working age men is 3.5 times higher than it is among the general population. For some further context, we often, well, in our world, we talk about fatality rates. The latest data that I looked at was 2016. In 2016, the fatality rate for a construction worker from a work-related traumatic injury was 10.1 per 100,000 people. And the suicide rate was 45.3 per 100,000 people. So that gives you some sense of the scale and gravity of the suicide problem in the construction industry. We know that there are some contributing factors. I wish we knew more about all of the connections that related to this, but we do know that it's a considerable issue and that we've been taking proactive steps to help provide information, guidance, and training on mental well-being and suicide prevention. This May, we published our first ever suicide prevention focused publication that is available in English and Spanish and informs workers of what to do if they think a coworker may be at risk of suicide. We've also signed a new alliance with the Foundation for Suicide Prevention, and we've been working at the grassroots level to address suicide. And there have been some notable examples of how our work has made a difference. In one case, our outreach folks, our consultants, have been doing this training with workers and employers. In one case, one of our staff members got a call from one of the employers that he had trained, who was in law enforcement, and one of the officers under his supervision called him one night with his service weapon in his lap, preparing to kill himself. And through the training that we provided, this supervisor was able to get the worker the help that he needed. But almost more important, the training that both of them received made that communication happen and made that worker reach out to the supervisor for help, because they had not only learned its importance, they had worked on building that trust so that it could happen. In another case, we had a staff member in Missouri telling the story of how one of the supervisors that he had trained had let him know, hey, this training really made a difference and saved a life. I had an employee call me from the side of the road, and he had his car door open and was ready to jump out into traffic in front of a tractor trailer on the highway. And because of the information this supervisor had at his fingertips, he was able to, call suicide prevention, get this worker in touch with the right people, they were able to find a bed for this worker in a psychiatric facility and get him the help they needed. And after the talk was over, someone came from the audience and shook his hand and said that he was the person on the side of the road. So those kinds of stories really make you realize how doing the work to build these human connections in the workplace so that people are really working to care about each other makes a huge difference. We're also focused on health, safety and health management systems, or SHMS, and how these are an important tool to have a comprehensive approach to health and safety that can include total worker health. We are first leading by example. We have our own vigorous SHMS program at the Department of Labor. We are the point on negotiating that with our union that represents employees that are in the field. And I'm proud to say that this year we negotiated and implemented a new chapter on mental health in the workplace. It's part of our health and safety management program. We're also providing tools for employers to do similar work. We're soon releasing it's under clearance now, I believe, a workplace stress toolkit that employers, unions, and workers can all access in order to determine how they can better access and work together to reduce workplace stress and identify indicators that can lead to greater health hazards in the workplace, including suicide. And we also have our Safe and Sound program, which is a program that promotes health and safety and health management systems. This year, we have compiled a lot of the materials all in one place and have especially focused on things for smaller employers that might otherwise be intimidated by these systems, so they can start to build in a kind of modular way the pieces that they need to have a more comprehensive program. So they can do things like write a vision statement or determine what their health and safety mission is. And it gives them opportunities to include aspects of total worker health in their programs in a way that they might otherwise be intimidated or overwhelmed to address. We're also incentivizing health and safety management systems through some of our enforcement activities. For example, we recently modified our severe violator enforcement program, which is a program by which, when certain criteria are met, we will target an employer rather than on a worksite by worksite basis, on a more corporate basis, because we have seen what in essence is a pattern of disregard for workers. And there's a pathway to get out of that by having compliance and abatement and other things. But one of the elements that we've added to get out of that process earlier is to implement a safe, a SHIMS program that we've looked at, that's been implemented, that's been perhaps validated by a third party that can and is effective. And that's another avenue by which we can include total worker health concepts in the workplace. I do want to add one thing about SHIMS and recognize that this is an approach that requires a deep commitment from management to embrace health and safety as a core value, and that a safety and health management system approach that embraces total worker health also has to embrace a total management approach, and that it's going to be of limited utility if it's just another thing for the health and safety department to take care of. It requires leadership from across the organization and the vision, at the sustained vision from the top of the organization to make it work. We all want workers to be able to enjoy good health during their entire working life and when they're finished with work in their retirement. And that's really how I think about our mission. We go out and do inspections, we do consultations, we work with NIOSH on research agenda, but what it's really about is making sure that people can go home healthy and safe, to make sure that people end their working lives and are able to play with their grandkids without partying around a tank of oxygen and those kinds of things that keep families together, that keep communities together. We're also committed to working to help business owners, employers, and workers across the country embrace health and safety as a core value and align their business practices and operating principles with that value, so much of which is related to total worker health. And I want to also offer a word of appreciation to the employers who are participating here, either in the audience or virtually, and are interested in these issues. And I certainly appreciate your interest and your commitment to a strong health and safety program. But it takes all of us to realize this shared vision of workers being safe and healthy, and we are certainly committed to it. And I am glad to be here in a community where there's also a similar commitment. And we look forward to working with you and finding ways in the future to advance this important topic. So thank you very much. I think we're going to take a few questions now, myself and Dr. Howard.
Yes, thank you.
Yeah, here we go. Thank you very much, Doug. That was exceptional.
could definitely feel the passion in your voice with some of these remarks. And as we are welcoming our first person up to the podium to ask a question, I will just pose one to both of you. One of the other challenges that we're seeing increasingly on the minds of employers, an additional non-traditional hazard, as it were, is the issue of substance use disorders in work. And we know there are dramatic differences across industry and occupation when it comes to this issue. Not to implicate the workers themselves who choose one profession over another, but because of the very nature of those jobs. So can you tell us more about OSHA's interest in substance use, impairment issues, some of the other challenges, and then we'll ask Dr. Howard to weigh in on the same issue.
Certainly. Well, we know substance abuse, and in particular, opioid abuse, is a tremendous problem. It is really a crisis in certain parts of the country and in certain industrial sectors. I think that it's important that, as your comment alludes, that we move away from simply blaming the worker, and that we look for ways to support workers and find treatment. And that, of course, this is all connected to other issues such as suicide. I'd also note that, we have to have a broad view of impairment on the job, that it's not just about substance abuse, but there's other things that can cause impairment that, as part of a total health program, employers need to be aware of. There's recent research on the impacts of heat exhaustion, the stresses in people's lives, other conflict at work. And these are all factors that employers need to be aware of, and that we encourage them to consider in their health and safety programs.
Yeah, I certainly agree with the comments that Doug just mentioned. I think I would broaden the issue beyond opioids to other substances that are also affecting workers. And, as Doug pointed out in his keynote address, you have to see some of the other dimensions of this issue, and certainly the economic issues that plague certain areas of our country that were associated. The other issue are prescribing habits that physicians had, pharmaceutical companies, et cetera. When you start looking at any one of these worker issues, it rapidly becomes a sort of huge scope. And I think it really challenges, if I may, researchers in this area to be able to take one of these problems, dig into it, and realize that they're multifactorial. And I think that's the real challenge that we have in this area of total worker health. So sort of digressing here a bit, but how do you do the kind of research that's necessary to be able to understand the totality of the issues that are affecting any one particular issue? So that's my observation about it.
Great, thank you. Appreciate the 5 folks we have in line. That will carry us to the end of the Q&A period. So let's get started. Ron, welcome.
Yes, good morning. Ron Getzel, Johns Hopkins Post Center for Mental Health in the Workplace. Mr. Parker, I appreciate very much your comments, especially kind of the human elements that you bring into the discussion. And I'm interested in your thoughts about, how individuals are affected by their surround and the effects of all the occupational health hazards that they face. I'm curious to know whether you think total worker health should be moving in the direction of occupational safety and health in terms of compliance with regulation, as opposed to guidelines or best practices or other ways in which employers can move in the right direction. So is there a need for more regulation in the area of total worker health, especially in mental health and well-being, versus just expecting them to follow guidelines and best practices?
Yeah, I think that's a very interesting question, and that while there may be some opportunities to import elements and principles of total worker health into other standards, that as a practical matter, given the challenges and length of time it takes to do rulemaking, and how stakeholders may at this time view our mandate to do regulations, that we can be more effective using guidelines and using the sort of power of our pulpit. So I wouldn't rule out, incorporating elements, but in the time horizon I'm thinking about in my job and making a difference, I would be more focused. I am more focused on how we can help with some of our soft power tools.
So I wanted to make a comment, which is a little more positive on this issue. First of all, I have never heard an Assistant Secretary for Occupational Safety and Health at DOL articulate what Doug just articulated in his keynote address. The awareness of total worker health, what you could do within the OSHA jurisdictional area with the concept of total work. I never heard anybody from OSHA talk that way. So first of all, I think it's a start, and I think that we can build on it. NIOSH, in comparison to OSHA, has a broad ability to take on any worker. OSHA has a more narrow scope, but I think the attitude that Doug has evidenced this morning here is a start in building between all of us a broader scope of what OSHA can do.
I'm Emily Wolf, and I'm with the Health Enhancement Research Organization. There we go. Let me just get a little closer. My question, I've been trying to figure out how to formulate this question as opposed to a comment, but you have touched on a number of things that I think speak to the UN's Sustainable Development Goals. And I'm wondering where total worker health, NIOSH, our government, U.S. Department of Labor, what is our role as a business community and as researchers in advancing some of these goals, specifically good health and well-being, decent work and economic growth, gender equality, reduced inequalities, climate. You've touched on a number of these things, and I'm wondering how we can, or what we can do to be a part of that movement and help support it.
I don't know.
So
That's a hard question.
That's a big question. I think it may start with something as simple as rolling up your sleeves and looking at some of the practices that are happening now. I was at an event, a summit yesterday at the White House on indoor air quality, and we heard from property managers, Silverstein Management, Salesforce, and others about some of the tools that they're using, some of the low-cost solutions that are out there to improve indoor air quality. And so I think it's a matter of just starting with actionable items and moving them forward and promoting a culture of small p progressive actions to advance these and to take a values-based approach within your organization.
So I would comment, if you go to our website on total worker health, future work, and all that, you'll see that we have, I don't know how many issues, and your list is just a part of the, I think under workforce, and the technologies of work, et cetera, all of those issues that you mentioned are there, and many more. And so I think that shows to the broadness of what total worker health can encompass. And I think it's really up to the research community and funders, like NIOSH, to be able to explore those and give researchers the opportunities to be able to explore all those issues. But I don't think that we have limitations on the kinds of issues that you raised in your question, or all of those other topics. I think any topic that's related scope-wise to a worker, as Doug mentioned, in all of those stories and the connection that workers have to whatever is going on, it's a health issue. It's a worker safety, health, and well-being issue. So I think it's really an exciting area for researchers now to bring in, as Casey mentioned, this transdisciplinary sort of approach. So we get industrial psychologists and sociologists and others involved in all of these issues. So I think it's really opening the door to an exciting research future.
And I'd be remiss if I didn't just say again, listening to workers is important in that regard.
Great. Thank you both. Yeah, John is referring to our issues graphic that has 107 topical areas of interest where we think total worker health has a major contribution to make. Of all the issues that you raised from Hero, one of our newest partners that we're happy to have on board, there is research in one of our centers of excellence in each of those areas as well. So this is an area where we've invested, we have active research, and clearly would welcome others to collaborate on all those topics, including Diane Rollman, who's one of our center directors from Iowa.
Good morning. Diane Rollman, University of Iowa, Healthier Workforce Center of the Midwest. So I'm going to switch gears a little bit and think about, we've seen an increase in remote and hybrid work. And what role does OSHA play when we think about the hazards that these workers face, not being in a physical work environment? How do we address those, and where does OSHA end or begin in those opportunities? Thank you.
Well, there's certain folks working at home are definitely still engaged in work. We have tried to provide a guidance, and I think there are other excellent sources, such as NIOSH on ergonomic principles for, which is kind of one of the leading issues. And I think that there've been some companies that have been excellent in that regard in ensuring that that workers have a safe environment that free from ergonomic hazards. It's always going to be a challenge as the workforce becomes more diffuse, and you have sort of smaller sections, and then you add to that the complexity of someone working in the privacy of their own home. One of the object lessons that I learned years ago in a little talk about the history of OSHA with Rich Fairfax, who had been in charge of enforcement programs, was just the storm of fury that occurred once when the agency issued a memo noting the authority to conduct inspections in workers' homes. And so I think it's something we have to be really careful talking about, and just recognizing the complexity of addressing that issue, and how it plays into our own limited resources and what we really ought to be doing with them.
I would have expanded your question a bit to the workers' comp area, because that's a really fascinating area where workers' comp insurers are trying to figure out, well, what is a work-related injury when you're sitting at your kitchen table with your laptop? And that issue, I think, is a very interesting one, and it makes the OSHA issue maybe sort of pale in comparison, because the insurers are trying to figure out, what's compensable here, and that's a real issue right now.
Just came from the International EAP Association, and it was their consensus that two new problems emerging that they're not typically hearing from clients over the years: an increase in social anxiety disorders related to the issue of return to work, and also high levels are reported of loneliness. It probably would not have been on the top of our minds a few years ago that leading workplace issue is loneliness. So, quite interesting. Sir, welcome.
Maybe a little closer to the microphone.
My name is Kaduri. I'm from Nigeria. Actually, I'm highly impressed about the pension, because it has been a big issue in our workplaces here in Nigeria. And I want to know if the OSHA partnership with the organization, is there any tool that will supplement those we see on NIOSH webpage as per suicide prevention in workplaces? Because it's part of during this conference, actually, I see one organization that come with something like this that we can just pass to whoever that is suspect that have a suicide intention. Is there any other tools that OSHA is producing to make sure that suicidal attitude is reduced to BRS minimum in workplaces? Thank you.
Some of that was in and out. I saw the coin. I know that we have worked with the AGC and other contractors who use the suicide prevention coin as part of their outreach with with workers, and we've been supportive of that, and we have worked with them, and I think that it's a it has just not only the gesture of passing that coin on, but also the information that it has on it is important for workers who may be in crisis to have with them. So thank you for raising it.
Yeah, we're proud of our partnership with CPWR, who just did some amazing work around suicide prevention in construction and opioid use disorder, overdose deaths related to construction. So thank you for bringing up that issue. We do have time, Jonathan, only for one more question. So I'm going to let this lady go, and then we will wrap up. Ma'am.
My name is Brittany Linner. I am a PhD student in occupational health psychology at Colorado State, and I'm also funded by the MAP ERC as a trainee. And I appreciate you bringing up substance misuse. I'm particularly interested in medical marijuana discrimination at work, knowing that there are no standardized indicators for impairment, and it's possible that an employee may not be hired based on a drug test where marijuana was in their system perhaps 28 days ago, or after a post-accident drug test, they may be fired. And I know there's a lot of changing legislation regarding medical marijuana, and I'm wondering what conversations are looking like at OSHA and NIOSH on this issue.
Well, there's with respect to marijuana, there's of course the as more businesses become are legal, we're having challenges in that area just with the novel health and safety issues related to the growing, processing, and distribution of marijuana, and that's coming up more and more. With respect to the substance abuse issue, we are in the process of reviewing our policy on how we, on issues related to when drug testing is retaliatory, and so that's something we're certainly thinking about, and it's complicated by legalization. It's always been complicated by the fact that there's not a true test of impairment with respect to cannabis. But what we're looking at is just how we can ensure that where drug testing occurs, that it's not, for example, only addressed to the injured party, or that it's being used in a way that is retaliatory or really unrelated to the narrow need to investigate the accident and really determine what the real cause is.
Great. Please join me in thanking Doug and John.